I think they can hear us. Okay.
There's microphones in the ceiling now. So we're gonna try that.
Wonderful.
All right. We're getting
Thanks,
fancy.
thanks to Harry and staff.
Thank you. Good. Well, it's 5:30. I'll call a meeting to order. May we have roll call, please?
It is 5:31 p.m. Director Perezquio. Here. Director Shore.
Here.
Director Demaro. Here. Director Logsdon should join us shortly. Secretary Barraza. Here. Vice President Rodriguez.
Here.
And President.
Ready, begin?
I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. May I have a motion to approve the agenda?
So moved.
Second.
All in favor, please say aye.
Aye.
Opposed? Motion carried.
Director Rogers, I'd just like to make the report after closed session.
All right.
Okay. So thank you. This, for the record, this is the report after closed session. The board just met in closed session concerning a potential litigation matter. The board directed counsel to take appropriate action to reject the claim of Camilo Nakato. Thank you.
Thank you. At this time, we have public comment. Comments from the audience may be made on items not listed on the agenda and that are of public interest within the subject matter jurisdiction of the district. Board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Are there anybody in the public that wishes to make a statement?
Any public comments for items not listed on the agenda?
Are there any comments online?
There are none.
Okay, we'll move on. Next, we have a consent agenda. We have 4 items on the consent agenda. And have a motion to approve the consent agenda, please.
So moved.
I'll second.
All in favor, please say aye.
We have to do a roll call vote because we do have financial.
Thank you. Roll call, please.
Director Perezquio. Yes. Director Shore.
Yes.
Director Demaro.
Yes.
Secretary Barraza.
Yes.
Vice President Rodriguez.
Yes.
And President Rogers.
Yeah. Thank you. Next, we have a presentation. One Future Coachella Valley's Black and African American Healthcare Scholarship Program. We have a video update.
So if I may, this is from a grant that the district had approved, a 2-year grant for healthcare scholarships for Black and African American students. We ran them through One Future Coachella Valley, and they are going to make a presentation at the request of Director DeLaros a while ago, I didn't forget. And we also do have a video presentation from one of the students, I believe she's a nursing now. Give her story. And Christine Gregorio will be
Yes.
giving a presentation.
Yeah, thank you, Donna. There's a clicker.
We have a remote. We do not have a transitioner. I mean, we have a, we can, you can use the mouse, you can get it from there.
The mouse.
And then I don't know if you want, let me open it for you.
You're doing that.
There we go.
Awesome.
Or you can use the keyboard transition.
It's right on. Cool. There we go. So hi, everyone. Good evening. My name is Christina Gregorio. I also want to introduce our CEO, Sheila, who I think everyone knows. Also present is Ernie Rios, our Vice President of Student Success, and Fatima Salcedo, our Senior Program Coordinator. And so we all do this work together to support our students. And so we were asked to do a presentation on our BAA scholarship initiative. But before we start, a little bit about One Future is we're a local nonprofit, and we help local students through high school into college and into their career. So our focus really has been to support at-risk students or at-promise students through their college and professional development. For this evening, as we move on, I wanted to share a little bit more about One Future. Our focus is these 4 areas. We are focused on an educated community as a driver of economic advancement, inclusive leadership and planning, a talented workforce within the Coachella Valley, and an economic opportunity program for local residents. And so as we're hearing the presentation today, it's really important because these are the 4 areas that as a team we focus on and we think are important for our students to be successful and for our students to thrive locally. We know that the work is not done alone. We know that if One Future was doing it in a silo, we wouldn't be as effective as we are with the support of our funders or our other local nonprofits. So in 2012, we convened K through 16 education partners, business leaders, civic partners, and we formed a regional college and career plan. And in that plan, we came with 5 different big goals that we wanted to achieve. And some of them were obviously increase high school graduation rates, which are really strong locally. We wanted to increase college readiness, and we wanted to increase college completion attainment, as well as degree completion and certificate completion, and increase career readiness and help the students land equitable paying and high paying jobs. And so as we move on, about 4 years ago, what we noticed, because we've been doing this work about 20 years, give or take, and we've collected a lot of data throughout the years, we noticed that there's certain pockets of students that were not persisting at the same rate or were not continuing at the same rate as other students. And so those are our Black and African American healthcare students, and especially in the healthcare pipeline field. That's where we were noticing a gap. So we came to Desert Healthcare District and we wrote a grant. And so 4 years ago, we launched this initiative together. And thus far, we've supported about 29 students up to date. But what was really cool about it is we hadn't really worked with this particular group of students. And we said, we want to bring together a group of community leaders who can help guide the initiative. We didn't want to assume that we knew what the students needed or what the community needed. And so we brought together local nonprofits, education leaders, business partners, and we set up an alignment team. And this team has been meeting monthly. We've been giving them our progress on scholarships, our student support services, and they've really helped us along the way on how to support the students or how to overcome the challenges that we're seeing them presented with. Ventrese Stiggs is our co-chair, and she's been at the forefront of guiding us with this. But I wanted to lift that because I think as you hear the story of our BAA group, you'll see that there's been a lot of community impact in how we've supported these students. And so some of the things that the committee has done is they've provided educational workshops from scholarships, financial health, motivational speakers, imposter syndrome, things that we've recognized our students in this particular group needed. They've also helped the students create social networks, social capital, because that's one of the areas that the students felt like they were lacking. They weren't connecting to the right resources, the right people, or the right opportunities throughout their education. And we are also happy to say that this group has been providing financial support. They've either given us sponsorships, directly donated to scholarships, or helped us fundraise for this initiative. So it's a very, very engaged committee where they've shared their time, talent, and definitely treasures. And so moving on to the students, it's pretty exciting for me. I've done this work for a while. One of the things I've learned in my job over the past over 20 plus years that you can give a student their scholarship, but if you don't connect it to some type of support, especially with our at-promise students, it's not going to take them as far as you can with wraparound services. So some of the things that these students received because of the support that the Desert Healthcare District provided to our program is wraparound services. And we really help the students complete a college and career plan. We do intentional academic and career guidance. We do financial assessments. Where are they at? Can they pay for college? Do we need basic needs? We also do professional and leadership development because that's another component that a lot of their students have said is lacking. And we do wellness, which is mental wellness, making sure that the whole student is feeling supported and that they can do their best. And so these are some of the wraparound services that we provide. In addition to that, we also have different leadership conferences throughout the year. Some of them focus on professional development. Others are more focused on mental wellness. And so those are 2 throughout the year. And then we have bridge to career, services as well. So you'll see a lot and you're like, wow, is the student doing all of that? No, the beauty of our program is that we don't do cookie cutter, which is, I think, a lot of the times when you try to do that, you don't get the the results that you want. We do customized. We meet with the students, we follow them. If they're doing really well in certain areas, we move out of the way. If they're lacking in certain areas, then we're like, hey, this might be a gap. And that's where we kind of focus on. So you'll see a menu, but it's really student driven and student directed. I can talk to you about 29 students, but I think when you see faces is when you really can connect, right? These students have all walked through our doors, met with us, attended our events. You'll see the little yellow hats. Those are our graduates thus far. 4 of them are nurses and are working in local hospitals. So that's exciting to us because I think that's exactly what we set out to do. We set out to support them and then we wanted them to come back. And we're starting to see more because a lot of them are like in their 3rd or 4th year or almost at completion. So these are the awesome students that we get to work with. We've learned a lot from every one of the students and from having the opportunity to run this type of initiative. I think that's the exciting part for our team is that sometimes when you're running initiatives, you're going so fast that sometimes you can't pause and learn and shift. We've been able to pivot. We've been able to pivot some of what we're doing with students, but we wanted to know a little bit about them, the students themselves. And so when you look at these numbers, you'll notice right away that many of them were choosing to go out of state or private, and not as many were staying at community college or at in-state institutions. We've learned since then that it was because either their nursing schools that they were applying to were impacted, or they were being declined admissions, or they just didn't know. They were just kind of picking because their friends were picking, or they were picking online programs that fit their work schedule. So there's different things that we kind of figured out. And so I'll talk a little bit about how this can impact time and financial poverty in the next slides. But we also noticed is there are a lot of nursing students. There's a lot of nursing, it's a pathway, and I think we have a shortage. So hopefully we'll get 50 more students in the next few years to stay locally. So that was another thing that we noticed. And then you'll see them sprinkled around other majors. And the second, I think, most popular one was behavioral health, which in connected to COVID, we've known there's a shortage there too. So we're excited about having these students join the workforce. As we met with the students, we also noticed a couple of other things. 68% of them were non-traditional students, meaning that these are students that are older than 26. They're either married, they have kids, they're working full-time, or they're caretakers. So that means that they have different challenges that they're facing now, because not only are they going to school, but now they have other things that are, might be a barrier for their completion. So we worked around our programs to ensure that we were meeting them where they were, and that we could support them with finding other resources that they need, whether it's childcare, food, CalFresh, and so on. All of them are from, 72% of them graduated from a local high school, but they're all local residents for at least 3 or plus years. So you'll see some of them that say CV residents. Well, those are students that have been here in the Coachella Valley at least 3 or plus years. But we're giving you a little bit of the landscape, because what happens is that as you're supporting students, you can say, let me give you a scholarship, let me help you get on your way. But we also do a full financial assessment to make sure that the scholarship we're giving them is also complemented with federal and in-state aid. And so as we're talking about the students staying in school longer or working or having kids, you'll notice that for the most part, the Pell Grant is federal, so that money follows them wherever they go, in-state or out of state. But if you move on to the other side, you'll notice the Pell Grant, that is only in-state. So if we learned that if a lot of our students were going out of state, they were leaving a pretty substantial amount of money for an in-state institution. And that was a flag for us because that meant they were having to supplement that with either their pocket or with loans. And we worked hard to make sure that the students either were looking at their packages or were accessing other scholarships. But as we move on, you'll notice that some of the students have accrued a substantial amount of loans. But these learnings are helping us as we move on to other students. This past year, we did a college and career high school outreach series where we're working with parents and families on how do you select a university? How do you select a program that not only fits your career choice, but also fits your financial, your pockets, right? Like your financial ability to pay it. And so as we were mentioning, the loans stood out a lot for our team and our advisory team. As it is nationwide, Black and African-American students walk out with a larger amount of debt than the other average students. They walk out with about $60,000, $58,400 compared to other students. In our cohorts, we were noticing that some didn't have loans, but that didn't mean that their whole tuition or school was being paid. Some of these families were middle class or lower class and were paying about $1,000 a month as a family out of pocket. So that was creating certain barriers for those particular students. We also noticed that some of them were taking out pretty large amount of loans. And so we're working on how do you get ahead of it. And some of the work that we're doing is we're doing it with the local high schools, with our partners to try to get the word out on how you get, like I said, a better university that fits your financial and academic needs. And so as we talk about it, I can say all these scenarios, but we wanted to kind of paint a picture or show you a picture of one of our students and what we mean by time and financial poverty. We had a student that started graduated from high school in 2015 and started their undergraduate degree at UC Davis and was majoring in French. Did 1 year of science, didn't do well, didn't get the right advising, ended up changing her major and said, I'm going to do French because that's what I was told. I'm going to graduate. While they did that, they exhausted the Pell Grant. And then at some point they were no longer, eligible for the Pell Grant, graduated with their degree in 2020, but had already exhausted some funding. Then went on to a community college to do the prerequisites for their, nursing degree, which took more time, and then went on to start their master's and was able to get the Desert Healthcare District scholarship, which was really helpful, but finished the master's in nursing in 2023. So that was 8 years, and that was longer than what the student had anticipated or wanted. They walked out with a pretty substantial amount of loans. And that when we look at it, had the student had the right academic guidance, the right professional guidance, they may not have taken 8 years or may have not accrued that much debt. And so that's what we mean by trying to fight the financial and time poverty. What we're really excited to share is that we've learned a lot, and we're hoping to continue to learn more and continue to support more students. But as we shared, intentional academic and career guidance is really at the top of the list. How do you really help the students and their families navigate this process and ensure that they pick a college that fits them and that they stay at and that they feel like they belong there and that they're getting the right support, right? And then, sharing with them, like, do you pick in-state, out-of-state? What does that mean? We also learned that because they're non-traditional students, there's opportunity loss. And what we mean by that is that some of them can't do the traditional internships or clinicals because they have kids. They have responsibilities. So the longer they stay, the more the barriers. And so our whole goal is how do you get them to finish faster And how do you get them to, start their career and their life and start earning an income? Because the longer they stay, the longer it takes for them to earn an income as well. And then the last two that we found was financial health. Just financial literacy is so important. I think we all know that here, or we've learned along the way. How to borrow. I mean, we get it, we get told that sometimes students have to borrow. We agree. But what is sensible borrowing? How much should they borrow when they go to college? And the average is about 25,000 for 4 years, not 180,000 for, so on for 8 years of getting a nursing career, which they're employed, they're working and they love it, but it is harder. And then the other findings that we found was having an advisory committee for our team was really helpful, because when we came across certain challenges, having sounding boards, asking them what they thought, what their lived experiences were, what direction we should take was really helpful for our team, because then we were able to meet the students where they were. And so these are some of the learnings. Oh, and I don't want to forget the three-way collaboration. So the fact that Desert Healthcare District supported us, One Future, and our community was involved was really an excellent example of how, as a community, we really can enrich our surroundings and our students. And so that was a really great learning for us. What we're excited to share is that after all is said and done, we have 90% of our students are either persisting and enrolled or have graduated from an undergraduate or graduate degree or close to it. We've lost 3 students, and it's been for the inability to do clinicals because they're non-traditional students and their parents, or the whole sense of belonging and not finding a right match to the university. Those are the 3 students that we lost, that we're not sure if they're going to go back. But in a nutshell, that's that. We wanted to show you one student, and I'll just start it by saying that she has finished, and she finished fall of 2023, and she's currently working at a local hospital. And she's doing great, and her husband's also going to be a nurse, so it's continuing to move forward. And we just want to say, on behalf of One Future Coachella Valley, we appreciate all of the support that you've provided to our students, and we're excited to continue to share updates as well.
Thank you,
Thank you.
Christina. Thank you. Are there any other? Are there any board, go ahead, Nat.
I have a question. So you mentioned that, that there were some students that did not complete the program, the four, students. During the program, as they're going through, you had, the different areas of study, hygiene, nursing, behavioral health. During the program, do the students get an opportunity to be in those settings so that they can make sure that they are going to be happy in those fields so that they don't end up later on needing to change? Do they get hands-on experience? Do they get to see, make sure that they're not scared of blood when they're becoming a nurse, you know? That kind of a situation. So I think you mentioned the networking, the professional developing, the network and the referrals, but does that include internship or being in the work environment?
Yeah, so there's different opportunities, and for the most part, as I'm thinking through, they do get hands-on, but we also partner with Health Career Connections during the summer. So many of them are encouraged to apply, and we've had some of those students do internships through Health Career Connections, and it is one of kind of the check boxes that we do. For the most part, for this particular group of students, because they're older and I think in some ways have learned, they have those clinicals, or they're actually working already like as a phlebotomist, but are now in a nursing program. And so that's the intention, and we've been pretty good about making sure that we direct them to those resources.
Thank you.
Any other questions from board members? Sarah? From public? Thank you, Christina. We'll move on to reports. Desert Regional Medical Center CEO report. Michelle, would you please address the board?
Oh, I'm sorry. I'm sorry. No problem.
Oh, if you reference your packet, you'll see that my usual report is on page 80. I do have a couple of additional items that I wanted to address with you this evening. You know, the first item is just to give you a little bit of update on the influx of patient volumes that's primarily being driven by the flu as well as some respiratory diagnoses. So we are currently operating under a higher census level than is our norm. And so I wanted you to be aware that in order for us to accommodate access to care, we are using some of our flex program beds. And basically what that means is we have certain flex waivers with the state of California, the California Department of Health, that allows us to convert some of the areas of the hospital into a flex up inpatient unit. So we are using some of those locations under the CDPH approval. As part of that approval, I want to reassure you that we do staff those areas with regular staff, with nurses who have the competencies in the level of care that's required in the various flex up units. So by that, I mean, if I'm an ICU nurse or I'm an ICU level patient, I have an ICU nurse assigned to me. If I'm a telemetry nurse or a telemetry patient, I have a telemetry nurse that is assigned for me. And this is all done under the auspices and the regulations as afforded by the California Department of Public Health. So we have found that in the months of December and January, you know, we really have seen more flu, primarily influenza A. It doesn't appear that if we go back to like the very beginning of flu season, October, and we cum the numbers forward, that this season is higher level than prior seasons, but it's clustering a little bit different in that December and January period. And where we go from here, we will see. So we've also received some updates on some pending surveys that we've just completed. And those surveys are in the area of graduate medical education as well as trauma. So in the graduate medical education area, there were 3 programs that I have to update you on. One is the institutional program, the surgical critical care, as well as the emergency department program. So addressing the outcome of the programs. The institutional program has moved to a probationary status. The surgical critical care program is a continued accreditation status, and the emergency room department program is a continuing accreditation status. So I will share with you that there have been some modifications made to the institutional programs. We have done this by fully engaging with the residents, the faculty, and the other key stakeholders in the program. We are continuing to strengthen the program. We do continue to enjoy the pleasure of being a teaching institution, even with the probationary status. We are on schedule to graduate this year's class in June of this year. We are currently in the process of going through resident interviews, and we are still completing the match process for next year's graduates. The other accreditation program that I wanted to mention to you that I am particularly proud of because of the circumstances is the American College of Surgeons Level 1 Trauma Accreditation. So we had a tragic loss a few weeks prior to the actual survey date. Our manager of the trauma unit took unexpected illness, and she did end up expiring. I am so completely proud of the trauma teams because they just rallied when we were discussing whether we should postpone the survey because of, losing a long-term. Heidi Anderson was her name, and she was with us for, about 30 years. She was an original founder of the trauma program with Dr. Erkley. And so the team just rallied and said, no, we're going to move forward. We want to do this in Heidi's memory and her name. She has us well prepared. She has us well trained. And we feel that it's really important that we not postpone the American College of Surgeons coming on site. This is particularly impactful to me because this is probably the most grueling survey you will ever go through. It's a level 1 trauma accreditation. And so on Friday, we received our report on the outcome of the survey, which took place in November. And I am proud to tell you that we were awarded full American College of Surgeons level 1 accreditation. The only other item I wanted to share with you, and I did make Chris aware because this did require notification to CDPH. We had a gasket in a plumbing area. I'm trying to think of the right words. We had a pipe that had a connection gasket that was located, believe it or not, in a connection corridor between our orthopedic unit and the administrative wing. And so that gasket gave way and created a flooding condition. It was immediately identified and immediately remediated. We had 2 patient rooms that were impacted. One was an empty room, so we just closed the room. The other had a patient in it that we relocated to another area. So since this was identified so quickly, we were able to make sure that the water didn't seep into any of the first floor areas that the second floor was located over. And so we continued to be fully operational, but we did submit the required notification to the Department of Health that we've had. It falls under a category of an unusual occurrence. Normally you don't have a gasket give way. So it's considered to be an unusual occurrence. And we did follow our remediation and our infection control processes as we repaired the pipe and the flooring that was a little on the soggy side. So it was completed within a couple of hours of occurrence. And that's it.
Great, thank you. Any questions, Michelle?
Michelle, can
Art?
you expand on the cause, impact, and ramifications of probationary
Yeah.
status?
The ramifications, as I told you, we are still a teaching institution. We are still graduating our classes, and we still are enrolling the new set of individuals. The way it works with the ACGME is they post the outcome before they actually give you the report. So I don't have the report. I just have to post an outcome.
Thank you.
Letty?
Okay, Michelle, regarding the accreditation, you said right now that you're still, getting, future, residents.
Residents, correct.
With this hanging, is it likely that you'll actually have a reduction of residents that are interested in coming because of not being able to know whether this is gonna be accredited or not?
Well, it will be accredited. We'll clear the probation. We'll make sure that I have extreme confidence that will occur.
Do you have an
And
idea of when you'll find out the timeline for recruitment purposes? Is that,
there are processes that you need to follow. So we do inform the applicants that the institution is probationary. So they do make a decision on continuing with us. The facility was on probationary accreditation a few years back, and we continue to fill all programs, and all indication is that will occur again this year.
good. And if I may, two other points on your report. One of them is, in the future, can you give us an update on the JFK emergency room improvements, how that's coming along? If you could please. And then the other is,
It's going to be a journey.
I know, I'm just
Okay.
kind of to put it on the radar if it's, just to know when it's starting, how it's coming along.
How the architects are currently advising us that we need to do all the mechanical and chiller work as a phase one, with the actual expansion of the emergency room as a phase two. And can I think about it? You have to have the infrastructure to support the expansion. So they're in the process of updating those drawings.
So maybe that would be on the report, is that you expect to have the drawings.
X date.
So just to kind of keep that on our radar as well. And the last item is, I was informed at our finance meeting earlier this month that the social services grant that we offered through Desert Regional is moving along fine, but that it's not operational at JFK because the auxiliary is not functioning. So if that's the case, is there any possibility that you could identify another way of making those resources available to residents in the eastern end? Maybe working with a nonprofit, I'm sure,
Just vouchers, is that?
the,
What?
It's usually gas vouchers.
Oh, it's the gas vouchers.
Yeah,
It's the child
for
vouchers.
discharge patients.
Okay, let me take that back and see. There should be a way.
okay, thank you. That's it.
Very good. Anybody else has questions for Michelle? Okay.
And just a reminder, President Rogers, to state public comment after each and every item.
Yes, I forgot to ask, are there any board comments, any more board comments, more public comments? Hearing none. We'll go to Desert Region Medical Center Governing Board meeting report. It's my turn this month to give you the report. I handed you a very brief report at the beginning of the meeting. The governing board met with Director Rodriguez and myself as appointees from this board. We met on Thursday, January 23rd. Scott White is the chairperson, who's the president and CEO of Visit Greater Palm Springs. And the medical staff this year is Swenning, Dr. Swenning. We had a report from Sam Roth, who's Director of Government Relations of Tenant Inc., and he gave a legislative update up to the governing board. I always enjoy seeing and hearing his review of the government, the state of the government at this time. And he gave some very interesting bullet points, which I shared with you. We heard from Dr. Swenning. We, as we always do, hear from the medical director, which gives the peer review committee report and the new medical staff appointments. Christine Langenwalter, who's a quality officer, always gives a quality of care report showing metrics for patient standards of care. And Dr. Zendel, our Dr. Zendel, was appointed as a community member who is on the board. And I love him being on the board because he always asks tough questions. And his last question was related to quality of care in comparison with other hospitals. And I pointed out to him that if you go to California Department of Public Health.gov and click on hospital reviews, that you can see all the dirty laundry of all the hospitals in the state. And then we had a financial report showing year-end financials. And Director Rodriguez, do you have any more to add?
You covered it.
Okay, thank you. Any questions? Any comments, staff or from the public? All right, we'll move on to our CEO report.
Thank you, President Rogers. First item is with regard to the Palm Springs Health Run and Wellness Festival that was held this past Saturday. Will, if you would you mind giving a brief update on how that went and our participation in the event as well?
Yeah. We had a really great day. Saturday, it was our second year as presenting sponsor. And that sponsorship level allowed us to have our mobile medical clinics there with DPMG Health. And we offered vaccines, COVID and flu and health screenings. Some of the highlights of the event, there were 2,200 attendees, 456 walkers and runners. Some of our staff were among the walkers and runners. Our CEO was there and our CAO and his family. One of the biggest highlights of the day was the awards luncheon. And we got to award one of our community partners and grantees. CSUSB Nursing Street Medicine Program, Diane Vines was there, presented an award by Carol. Greg was also there. It was a really good event. The organizers said that the runners, that number was down a bit because of the wildfires. The event tends to draw people from the region, but attendance was up. And I think it was a really good event for all of us.
We have a video also, just some of the highlights.
And then there was recognition. That's right.
I snuck it. Okay.
Thank you.
President Rogers,
Yes.
just one comment. How is it that Linda's hair still looks fantastic after running and?
I didn't run.
Walked across the finish line.
Okay,
Okay, next item on the agenda is just a quick update on the Healthy Desert, Healthy You Environmental Health Summit. As we're all aware, we held our first inaugural health summit last September. And so this is just a brief update to hold the dates for the upcoming summit this year, which will be September 11th and the 12th. There's some information in the staff report that indicates that we would have sessions on the first day and then looking at doing some tours on the second day. And so we're in process of developing the overall agenda, the budget, and other items that we'll bring to Finance Committee and to the board, anticipating next month for your consideration for approval then. But this is just an update. If you have any questions where we're at today.
thank you. Any comments? Go ahead.
Okay,
Agenda C.
okay, next item is, item C is the Regional Government Services. We had engaged with this organization to complete a human resource assessment and recommendations for improvement. And in your packet, there's the full report, but the first few pages are essentially the executive summary that indicates that Sherry Johnson, who was with us tonight from RGS, is here to answer any questions, but I'll just give a slight overview that we've worked, extensively with Sherry and her organization to review all of our internal documents, all of our internal processes, all of our handling of hiring, terminations, all of our document filing. And then also, those were found to be in good order. Additional reviews included our employee handbook, and there's some recommendations with regard to updating the employee handbook, and also, with other policies, et cetera, that the district has. They were able to interview all of the district staff and to be able to obtain feedback from our staff members. And that also has developed some recommendations for improvement internally as well. And so, we have operated essentially with an internal HR related person who's been the CAO, which was formerly me, and now since June has been Eric in that role. And so we've got some training and some improvement that we need to do to help educate and provide that internal training. And then also we would like as staff to continue with RGS and them providing services going into this next year to help us with those recommendations and to, ensure that we're in compliance with labor laws and helping us internally to work with developing staff, with trainings, et cetera, and to provide us the external expertise that we, as a small organization, don't have by not having a full-time professional HR person. So that's, the result of the report is here for you. If you have any questions to be able to ask us or Sherry. And then also on the consent agenda, there was the approval of the consulting services agreement to go forward with, allowing us staff to work with RGS to continue to develop and improve our internal processes.
Thank you. Any comments from the board? Ready?
Okay, I have a couple of comments. One is, I think I pointed this out at our committee meeting, that I think page 94, I would like to have the attorney included in that chart. So where he falls in this, it's important to be able to communicate that, that it's right next to, I think Jeff said that it was by the board of directors.
The dotted line.
You work for us. And so
Yeah.
I always thought you actually were next to Chris, but if it's up there, then see, there was this misunderstanding on my part. The second thing that I wanted to mention is I'm a little bit concerned about recommendation number 13. And it's not anything against our CAO. I think, Eric, you have a lot of expertise on the accounting part of it. But I believe that you don't know what you don't know. And for us to start in this effort of building you into the HR expert, it might be setting you up and setting up the organization for less than what we need. So I would like for there be some consideration to not add this onto maybe more of a that the person reports to Eric, but to expect them to all of a sudden become the HR expert, I think it's just not something that I think is reasonable.
Do you have a suggestion,
Well, there was a mention on here of having a part-time person and if you have the expertise in-house, we're gonna see in the next year how the board is, how we feel comfortable and how we develop. And if there's going to be an increase in programming, then maybe there's gonna be some positions that are gonna be added. I don't know. And if it's growing, you have a big area, region-wise, and to be able to address those needs, I think you need to pay enough attention to the HR as you do to everything else. And I think that the employees need the reassurance that there is somebody in the organization that has that expertise. And I just don't think that by going down this direction that you're kind of looking down this way instead of thinking about what is the possibility instead of being restricted, because that's what you've been doing up until now. So those are just my concerns.
Thank you. Anybody else have suggestions, comments? Anybody from the public? Okay. You have number.
Okay, next item on the agenda is a sponsorship opportunity that we have to support the 9th annual The Future is Ours for One Future Coachella Valley, celebrating its 20th anniversary. It's a $5,000 sponsorship. The event would be on March 21st. And this is also a matching sponsorship that we're doing along with Desert Care Network, matching $5,000 to that to support that event.
I would move approval of the sponsorship.
It's been seconded. Any comment? Any comments from the public? Staff? Please roll call.
Director Horacio,
Yes.
Director Delara,
Yes.
Director Logsdon,
Yes.
Secretary Barraza,
Yes.
Vice President Rodriguez.
Yes.
And President Rogers.
What about me?
Excuse me, Director Shu.
Yes.
Moving on to E.
Thank you, Director Rogers. The complaint validating the lease purchase agreement was filed with the court last year. And we are currently working with the court to issue the summons. The wheels of justice move slowly. We are hopeful that that will occur this week and we will be able to publish the summons in the Desert Sun on Sunday. That's all I have.
Thank you, Jeff. Going back to number E on CEO report.
Thank you. So the CEO engagements and district media visibility report is in the packet for your review. And if you have any comments, I'd be happy to entertain. Otherwise, it's there for your.
Any comments? Comments from the public? Okay, so we'll move on to committee meetings. Strategic Planning Committee, Vice President Greg Rodriguez here. Would you like to make a report on your committee?
Yeah, so we met and just went over the 2021 through 2026 strategic plan and reviewed the goals on that. The majority of the meeting was focused on, as we preliminary discussed at one of our strategic planning meetings, about the way forward and how we go about strategically planning for beyond the current strategic plan. And the committee basically came to consensus that we would like staff to go out with an RFP to start that planning process, basically keeping in place the strategic plan that we're in right now from 2021 to 26, but in concurrence is actually starting to work on developing that future plan. A lot of us talked about the need for the community engagement aspect for workshops, and so that we have a really comprehensive type approach to that. I'll defer to Director Barraza or Clark or anything else. So this is an action item, correct? Yes.
Yes.
So on behalf of the committee, I would move that we follow through with the staff recommendation.
It's been moved and seconded. Do we need a roll call, Andrea?
Are comments in order, Madam President?
They are.
They are, aren't
They are in order. I'm sorry.
Thank you. I've mentioned this at, I think, one or two previous meetings, that from my perspective as a professional healthcare person, the industry and the science and the delivery of healthcare is moving at such a rapid pace that a clearer and more comprehensive understanding of the future directions of healthcare, whether it's AI, as occurred yesterday in the stock market, as an example of how rapid and profound the changes are occurring. And by the way, there was an announcement yesterday that a new hedge fund has developed between some entrepreneurial individuals to fund an AI discovery organization on the acceleration of identifying new drugs, as an example of how quickly the industry and our world is changing. And when I made that recommendation a few months ago, I did it in the context of inviting the committee to consider engaging, albeit maybe in a secondary or a preliminary RFP, recognized healthcare futurists who spend their times focusing on 5 years and beyond, and 5 years to infinity in some instances, to provide us with a workshop or an educational experience to educate us and sensitize us so that when we get to the question of evaluating the specifics of beyond 5 years, we have a more complete understanding of how and where the industry is headed, that hopefully would allow us to make better decisions. So I don't know if that suggests an amendment. I don't know if that suggests a precursor proposal, but I'd like the committee to consider that either in retrospect or in prospect as it moves forward with this action item, which I am indeed in favor.
What I'm thinking is maybe we can include some of those points within the RFP.
Is included, yes. I know I always have said that I think a 5-year strategic plan, especially as we move forward, needs to be a 10, 20, and 30-year strategic plan. That I think I've said that, you know, in 30 years, we're going to be taken care of by robots.
And what our intention is in developing this RFP, which we will bring to the Strategic Planning Committee in February and then ultimately to the board to consider approval. But included in that is a long-range plan, looking ahead, 10, 20, 30 years, also including financial planning as well. And then within that, as we're looking at the long-range future, we're also then planning the next 5-year strategic plan. So it's kind of the 5-year strategic plan is a subset of the grander outlook for the district.
And I could see why.
I'm talking about an educational
And it's
process.
yeah, I understand that. And that's what I would suggest, maybe one of the workshop focused on that educational piece on the possibility of future.
That addresses the question. Thank you.
Any other comments? Any
Excuse me,
comments?
President Rogers, who seconded the motion?
I think Director Brooks.
Director Barraza.
Thank you.
So now we do a roll call.
Yes, ma'am. Director Bresgill? Yes. Director Delara?
Yes.
Director Shore?
Yes.
Director Logsdon?
Yes.
Secretary Barraza?
Yes.
Vice President Rodriguez?
Yes.
And President Rogers?
Yes. Wanted to welcome Dr. Logsdon into the meeting. I understand you had emergency surgery, which was more important than our board meeting, I think, to save lives. Next, we have the program committee. Chair President Yvette Perez-Gill, would you like to give your report?
We went over the draft meeting minutes for the January. We went over the meeting minutes for the one before. We did progress and financial reports update. We discussed Regional Access Project Foundation and the Desert Healthcare District Mental Health Grant Funding Partnership Memorandum of Understanding for 500,000. I believe is that an action item, Andrea?
No, but we do have a public comment once you're complete with your.
No, essentially what this is just updating the board that was reviewed with the committee. And the outcome of the committee members was to do a MOU partnership plan with.
If I may interrupt,
Oh.
before you get into that, I'll step out of the room, but before we get to that, on item A, can the minutes be corrected on page 148? If you can remove my name, that I was not part of that discussion. I think the motion on B and C, so page 148 and 150, if you can just correct that. And then I'll step out of the room. I'll recuse myself for the remainder of the program committee discussion.
Oh, actually, it says here, Director Delara recused herself from the discussion due to her role as the CEO.
But I wasn't there. I was not at
She
that.
wasn't in our meeting.
So I'm
She was in our previous meeting, but not that one.
I can have it both ways.
Okay, continue.
Yes, so what was the original that was received, the MOU that was received from RAP was requesting a 2-year matching 500,000 per each year for a total of $1 million from each of the organizations to continue the behavioral health grant funding program that RAP has developed. And great program, and we had provided the $500,000 and more previously. But what we took the approach this time is that we would like to internally be in control of the funds and to go through our grant process, and so that we do our normal due diligence with the grant recipients and, you know, all the tracking that we do with cost reports and progress reports, et cetera. And so it was then proposed that we would develop a plan then internally for our funds that would work in conjunction with the program that RAP is doing. And so staff wanted to have some time to be able to develop that. And so it was proposed then to do 2 years funding for fiscal year 26 and 27. However, it was recommended by committee members to limit that commitment to only be in the current strategic plan period, which ends June of 2026. So that would allow staff opportunity to develop over the next few months an RFP that would, you know, work hand in hand with RAP in this project. But it would be a 1-year commitment that would be fiscal year 25, 26. And then jointly with RAP, we would do like a marketing and communications program that would enhance this partnership role that we're having together in this behavioral health commitment. So that's the intent of it, and it's informational at this point. And then we would come back later then with an actual MOU RFP as that's developed over the next 2 or 3 months.
Are there any comments? Are there any public comments?
Yes. Is this what I do? Yes.
First of all, I will tell you this, it is not a drama statement. Good evening. My name is Jan Pai, and I'm addressing you as the board chair of the Regional Access Project. First, I want to express our board's gratitude to the program committee for recommending an allocation of $500,000 for fiscal year 25-26. However, I'm here to advocate for a larger commitment, a 2-year partnership for fiscal year 24-26. This proposal includes allocating 500,000 per year, matching the 1 million RAP has already committed. Our previous partnership has shown exceptional success. Together, we've developed essential services to over 70,000 individuals and provided cultural competencies training to 713 service providers. These results demonstrate the significant impact our collaboration has on the community. By fully matching our contribution with the Desert Healthcare District, we have enhanced opportunity to deepen our commitment to improving the lives of our residents. For instance, with the federal government's change in its administrative approach, our residents are becoming fearful regarding immigration and DEI. Our staff is ready and willing to work closely with you to redefine and enhance the process for this grant, ensuring even greater outcomes for those we serve, with appreciable outcomes through education and resident and evidence of results through RBA and marketing. Let's be proactive and not reactive. Let's collaborate and not work in silos for the benefit of our grantees and our residents. Though we may approach behavioral dealings differently, our approaches may reach the same goal, such as one working on students regarding bullying, and another on parents and social media and how that affects students and learning. I thank you for this time. I am not expecting a response from this today. This is simply giving you something to think about.
Thank you, Ms. Kai. Are there any other comments?
Yes.
Go ahead. Please go ahead and say your name.
Good evening, everyone. My name is Diana Morales. I am the Data and Systems Manager for the Regional Access Project Foundation. And I would just like to echo what our board chair, Jan Pine, just stated. This funding, again, thank you for the program committee's recommendation. The delay would impact our organizations and our residents since we wouldn't have more resources dedicated to behavioral health. Since both the Regional Access Project Foundation and the Desert Healthcare District utilize RBA, and we have data already existing from this partnership, by committing to 2 additional years, you would then have 3 years worth of data, which you could then use to inform your strategic planning session later in the year. That would be a great base and foundation. And I just want to echo that partnering together sooner rather than later would show continuity and our community that we are in this together to better the lives of our residents. Thank you.
Thank you.
If I may, President Burdisco, if I'm understanding correctly, I believe the RAP Foundation is anticipating in awarding these grants to recipients the latter part of the current fiscal year. Assuming, and correct me if I'm wrong, probably like May, June timeframe. And so our process would be looking at doing an RFP that would allow us to award grants the beginning of the fiscal year of 25-26. So I believe there's relatively short period of time that's different from when you're talking 2024, that you're awarding those monies than 2025 really, that it's close to our time that we would anticipate in awarding those funds. So I don't see the major difference in that start time overlap. But that's part of what staff will be working along with RAP to work through those issues. But as far as the 1 year commitment would be aligned with our strategic plan. And then, there's possibilities that if in our long range planning and our new strategic plan beginning in fiscal year 2027, that there may be additional funding that we could commit at that point. But we didn't want to commit that at this time until we go through our internal planning process.
Go ahead.
Can I just add on to that too, is it, just to kind of reiterate points in that, is that this was in no way to undermine any collaborative approach whatsoever. A lot of this decision was made around our strategic planning aspect. And I think, wholeheartedly believe there will be that continued partnership with the RAP Foundation going forward. Additionally, is the capacity of staff at this time to turn around an RFP at the same time as RAP's process was a little problematic, especially as we're going through not only the human resources aspect of it, but also the strategic planning RFP and all that. So that's how we kind of came to that decision.
Any other comments? Moving on to E, Yvette.
The grant payment
I have a
schedule.
question.
Go ahead.
Was this an action item or
No.
just information?
No.
Just information.
Information at this point, we'll bring back an action item later when we develop the RFP, et cetera.
And
Our
Yvette?
grant payment schedule is located on page 191 in the packet. Does anyone have any questions regarding the grant payment schedule?
Thank you very much. Thank you. Finance, Legal, Administration, Real Estate Committee, Dr. Logsdon.
Sure. Thank you. We had a successful meeting in January. Turn your attentions to, I think, page 192 in the packet. Kind of go over a couple items there. Our Las Palmas Medical Center is at 100% occupancy. Just excellent news. Our two biggest topics that we discussed were one, approving for during our Desert Regional Medical Center inspections, we outlined a new lease or new 5-year engagement with Dale Barnhart, who's been helping us before. So he'll be helping us continuing on those inspections as a prior facility inspector there. So we went over that agreement with him, which looked appropriate. And then the second thing we reviewed was the district's engagement with RGS as a human resource service provider to assist Eric and the team there with the needs in terms of human resources. So any comments, questions, and then I'd like to turn it over to either Eric or Chris if they have any comments about the meeting as well. Director Shore, Director Gallardo there as well.
Any comments?
We don't have any. I think it's pretty explained in the minutes and that, so.
Director Shore, Director Delara?
I'm fine.
That was the informational item. We'll move on to number I, board member comments. Director Rodriguez.
Yes, thank you. I attended the Live to Rise Housing Collaborative Action Network, which is one of the subcommittees I sit on. That was on the 15th of January. Really kind of just more about updates around Live to Rise's activities with Inland Empire Health Plan. They're part of a leadership network, which is actually a really good health next system housing piece. Having worked closely with IHP and still do, is they're really looking at more of the nexus between healthcare and housing, and actually are investing in that at pretty good levels. Nice to see. They've been involved a little bit with the Palm Springs Rental Assistance Project. The vast majority of the meeting, though, was going over new state laws, primarily around eviction and building processes that were passed last year, and kind of streamlining building processes as well. And then the last part of the meeting was really focused on reinstituting their policy and pipeline working group. This was a very active subcommittee for about 2 years, and it's kind of taken a hiatus over the last year. But especially as we get more into federal policy challenges around housing, they really felt there was a need to reconstitute that subcommittee. So
Thank you.
if there's any questions.
Any questions for Greg? Any other board comments? Okay,
I will just report that today, myself, President Rogers, CEO Chris, Donna, Alejandro, and Sergio were part of the ribbon cutting for St. John Community Health Center in Indio. It was very impressive. First of all, it was a great turnout, so it definitely showed that they had a great outreach and a great location, Central Indio. Lots of programs, lots of resources that will be coming to the community, and it will just add on to the other healthcare services that we have. So it's really good that that they're here, and we welcome them and look forward to having them be successful in our community.
Thank you.
And Madam President, one additional thing I forgot to mention too is like I've actually been asked to sit on the steering committee for the Blue Zones initiative in the city of Palm Springs. And a lot of that was because they want the involvement of somebody from the district in that initiative.
Excellent.
So, great.
Excellent. I'll be your alternate.
There you go.
There we go. Do I need to have action on that one, Andrea?
It's not an
It's not
agenda
it's not
item.
appointed yet.
All right, we'll get it there. Thank you. There was no CVAG homeless committee meeting this month. And I handed you an informational article about freestanding emergency departments. There are no freestanding emergency departments licensed in California. It sort of gives you a short description that it's a standalone but separate emergency department, in that it offers the same services as emergency care, lab, radiology, intensive care, but in a medically underserved area, and there's none in California. I had a conversation with our CEO, Michelle Finney at Desert Regional Medical Center, and she expressed some interest in supporting something like this that might be able to be offered in the East County, Indio, Mecca, all that area, and that they would support it. I also had an opportunity to talk to Armando Martinez, who is a representative of Senator Rosalia Ochoa Bo's office, and he offered to help me submit a constituent bill proposal form, which I did with the help of others. And it's been accepted to go to Legislative Council. It is still in the very baby kindergarten phase. There's no assurances that it will even be introduced. Director Barraza informed me that Indio Mecca is not even in Senator's her district area, so we have a lot of work to do, but it's a first step. I have no concept of how it would work, other than let's see if we can make it happen.
I do a little. But if this is something that the board actually wishes to support, I would recommend that we do have some like formal meetings with our local legislators and see if, if we can, I mean, there's 120 legislators, so we would have to convince one of them to run this bill. I mean, there's a lot to look into. But yeah, that would be the first step. But if it's something that the board wishes to do, maybe we could recommend our staff to continue with it.
You probably need to agendize that, right?
Yeah, we would have to agendize it. This has only been brought to our attention.
I think what you're seeking is consensus to agendize it.
Yes.
Yeah.
Yes. May I have consensus to agendize this for future meeting?
Yes.
There are legislative deadlines, so it could also be that we miss one of those deadlines, so I'm not sure if it's something that would actually need a vote and for direction and to start working.
And if I may ask, I mean, is this, if this legislation were to move forward, wouldn't it be considered for the entire state, not just for our district?
This is just a pilot project that we alone would run for us.
I see.
It's for a 5-year pilot project.
Okay, so, and it sounds like we would need to get other legislators committed with it, but and I don't know the whole legislative process, but it has been submitted to Ledge Council.
Right.
Understanding, and with I think that's like February 21st is when it actually has to be submitted.
We would need confirmation from their office. How I understanding is you submitted a request to their office to see if they'd be interested in engaging in the conversation. And then later on actually getting language from Ledge Council. So yeah, I don't think it's been.
I think in reality, this is probably a 2-year project, especially because both senators and assembly people are now limited on the number of bills they can introduce. And I'm all for it, you know that, but I think we agendize this and then we can talk about the timeline. Right. But I think in reality, and Kimberly probably agree with me, is that it would be almost impossible to get it on in a bill form this year.
Yeah, and we also our lobbyists, been communicating with them on it as well. They'll support us, do any heavy lifting that we would need from to support any legislation that may be making out of it.
Conversation with them and yeah, run the idea by them. And they'll help us connect as well with legislators up there that might be interested or might be working on.
Exactly. Yeah, and other legislators that would be, yeah.
So is there anybody opposed to agendizing this concept? Going forward, we will do that. Are there any other board member comments?
Just that that the extent that it exists, research on the subject that's already been published be provided to us in advance of any meetings on the subject.
Sure. This article I gave you is actually 24 pages. I only gave you the first.
Oh, let's see the other 23.
I can do that. Great. So, next we have no other comments, so we will adjourn for 10 minutes. 6:53.